I'm Bernie Bissett.
And I'm Allison Maher.
And we are from Canberra, Australia, the land of the Indigenous Ngunnawal people. We're excited to share with you the methodology behind personalised exercise prescription in long COVID. Our paper is a practical toolbox for a multidisciplinary approach. Long COVID is the persistence of debilitating symptoms at least 12 weeks following infection with COVID-19. This often includes weakness, fatigue and breathlessness. And there is extensive high quality evidence that in other conditions, these can all be improved with exercise. In 2022, we established one of Australia's first multidisciplinary long COVID clinics where exercise would be a cornerstone. Now, while there are some guidelines about exercise in long COVID, these focus mainly on pacing strategies and energy conservation, but they don't include enough information about specific exercise intensities or dosages and completely ignore the potential of respiratory muscle training, which can be highly effective in reducing breathlessness.
So we designed a program that offered more, and we assembled a great multidisciplinary team to make it happen. And in over 250 patients over 2 years, there have been no serious adverse events with our approach.
In our paper, you will find our detailed referral pathways and triage tools, as well as the screening questionnaires we use. But we'll now focus on sharing the details of exercise prescription.
The group program consists of twice-weekly sessions of 60 minutes, in addition to a home exercise program. Both of these include specific screening for post-exertional symptom exacerbation. If participants report signs of PESE, such as a drop in functional level or extreme fatigue following exercise, we titrate their exercise accordingly. This means they can progress safely. For resistance training, we prescribe 4 to 6 exercises 3 days per week at a submaximal intensity of 4 to 6 out of 10. Exercises are individually prescribed to account for the consumer's goals, preferences, and injuries. Exercises target global muscle groups using functional movements. Low-intensity cardiovascular exercise is gradually introduced with clinician monitoring for PESE. Those with severely reduced mobility commence with just 5 to 10 minutes of low-intensity walking or cycling training, aiming for exertion scores at 4 to 6 out of 10.
For those who find breathlessness difficult, we prescribe high-intensity strength training using an inspiratory muscle trainer. Patients complete 5 sets of 6 breaths with a resistance of at least 50% of their maximum, 5 days a week. Patients gradually increase resistance on their device so that it feels challenging to complete the 6th breath of the set. We've had overwhelmingly positive feedback from our participants, and we hope our toolbox is useful to clinicians around the world who are helping people recover from long COVID.